Good day, everyone. In this video, we'll talk about anxiolytics. Let's discuss which types of drugs are commonly used to treat anxiety, as well as the first-line agents, benefits, and drawbacks of each drug category. Anxiety is a mental disorder that causes people to experience persistent fear, worry, and tension even while going about their daily activities. Based on the cause and symptoms, these anxiety disorders can be classified in various ways. The first is GAD, or Generalized Anxiety Disorder, where anxiety persists for several weeks without any proper cause. Another is Social Anxiety Disorder, which causes anxiety during social interactions. Panic disorder is another anxiety disorder characterized by symptoms such as tremor, sweating, and tachycardia. OCD, or Obsessive-Compulsive Disorder, is another type of anxiety disorder where repeated unwanted thoughts and actions may generate anxiety. For example, fear of contamination may cause frequent hand washing in this group of people. Sometimes, a persistent fear of a specific thing, place, or object can be observed and classified as a specific phobia. Finally, PTSD, post-traumatic stress disorder, is another anxiety disorder where the recall of past stressful events induces anxiety. Within the limbic system, the amygdala plays a crucial role in controlling emotions and behavior. Any imbalance at this location may generate anxiety, which can bring tension and fearfulness that persist for longer periods. Many of the neurotransmitters are involved in the pathogenesis of anxiety, and among them, elevated levels of norepinephrine caused by sympathetic stimulation may generate the anxiety. Anxiety is also exacerbated by a decrease in the levels of GABA, gamma-aminobutyric acid, in the CNS. GABA acts as an inhibitory neurotransmitter that controls excitatory signals within the limbic system. Serotonin levels within the CNS highly influence the state of anxiety, and drugs that increase their levels have been proven to reduce anxiety. The enhanced levels of serotonin within the CNS bring about adaptive changes that may help in the reduction of anxiety. Anxiolytics are a group of drugs that can reduce this anxious state in the patient. As with so many types of anxiety disorders, anxiolytics involve different categories of drugs. Among them, 3 classes of drugs, which can be denoted as the 3 Bs, are primarily indicated for the treatment of anxiety. Another group of drugs also reduce anxiety and are therefore indicated for a few of the anxiety disorders, but they are mainly intended for other central disorders. For instance, SSRI and SNRI, or selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors, are actually indicated for the treatment of depression, and they are primarily antidepressants. But still, they are indicated for the management of a few of the anxiety disorders, and interestingly, these are the first-line drugs in the treatment of anxiety. Similarly, antiepileptics with multiple mechanisms of action are primarily used to treat different types of seizures. Few of these drugs have been found useful in the treatment of anxiety disorders. Antipsychotics are primarily used for schizophrenia to reduce psychotic symptoms. Among them, a few drugs, particularly atypical agents, are indicated for treating anxiety disorders. Beta blockers work in a different way. These drugs reduce sympathetic stimulation and thereby reduce cardiac activity, resulting in a reduction of autonomic effects such as rapid heartbeat, tremor, and sweating that are sometimes associated with anxiety. Because of their low side effect profiles, lack of tolerance, and low potential for dependence, SSRI and SNRI are currently recommended as first-line agents in the treatment of anxiety. Benzodiazepines are considered next, as they produce an acute response in the reduction of anxiety, but they can impair motor activity and are associated with tolerance and dependence. Buspirone is another anxiolytic that lacks the limitations of benzodiazepines and is therefore indicated for chronic anxiety states. Finally, other agents like antiepileptics, antipsychotics, antihistamines, and beta blockers can also be used for the management of anxiety disorders as alternative agents. Even though SSRI, SNRI, and Buspirone are beneficial due to their low side effect profiles, they still do not act immediately. These drugs show a delay in the onset of beneficial action. Consequently, they need a few weeks of treatment to produce any anxiolytic effects. Contrarily, Benzodiazepines produce acute pharmacological effects, reducing anxiety immediately. But their range of side effects, such as sedation and motor impairment, limit their use in the long term. Anxiolytics, primarily intended for treating anxiety, can be simply remembered with the mnemonic 3Bs. The first B denotes benzodiazepines, which are mainly indicated as anxiolytics and hypnotics. The second B denotes barbiturates, and the third B denotes buspirone. Among these drugs, barbiturates are getting very little clinical usage due to a wide range of side effects and drug interactions. Nowadays, drugs in this category are only indicated for the treatment of epilepsy. Benzodiazepines are well-known drugs and they are indicated for the acute treatment of anxiety, while buspirone is a 5-HT1A agonist indicated for chronic anxiety states. Nonetheless, these drugs are not the first-line agents for anxiety disorders. So let's discuss each category, how they work, and what the possible side effects are. Let's start with benzodiazepines. Benzodiazepines mainly increase the action of GABA within the CNS. Excitatory neurotransmitters like glutamate can be released and act on the postsynaptic neurons expressed with glutamate receptors. Activation of these receptors results in fast postsynaptic stimulation, leading to an enhanced response resulting in anxiety. But this excitatory response is controlled by GABAergic neurons, which release one of the inhibitory neurotransmitters, GABA. This mediator can act on GABA-A receptors expressed on postsynaptic neurons, resulting in an inhibitory response. Now, benzodiazepines can reduce anxiety by promoting the action of GABA. These drugs can bind to an allosteric site on GABA receptors, which accelerates the binding of GABA to the GABA-A receptor, leading to the opening of chloride channels and subsequent hyperpolarization. GABA-A receptor is composed of 5 subunits, and benzodiazepines bind to the site in between the alpha and gamma subunits, which causes a conformational change that results in the opening of chloride channels. So many drugs are included in this category, and chlordiazepoxide is the earliest benzodiazepine developed among them. Other drugs like diazepam, clonazepam, lorazepam, temazepam, flurazepam, alprazolam, and nitrazepam are generally prescribed as anxiolytics. Even though benzodiazepines work immediately, they are still not considered first-line agents due to their wide variety of side effects. Benzos can produce motor incoordination and muscle paralysis, which are more troublesome in the elderly. They also impair memory, resulting in anterograde amnesia and the loss of memory of current events. They also depress the CNS, resulting in drowsiness and sedation. That's why they should never be combined with alcohol. Tolerance is another limitation with benzos, resulting in diminished pharmacological response with chronic administration. Benzodiazepines dependence may result in withdrawal symptoms if the dose is abruptly discontinued, resulting in daytime anxiety and early morning insomnia. Despite these limitations, benzodiazepines can still be used to treat anxiety in the short term, and they can even be combined with SSRIs until the latter begin to work. The second category is barbiturates. Barbiturates also promote the action of GABA just like benzodiazepines, but they bind to a different site on GABA-A receptors. Phenobarbital is one example in this category, but nowadays these drugs are not indicated for anxiety due to so many limitations. Barbiturates can produce severe central depression, leading to sedation and drowsiness. They can also produce significant respiratory depression and result in shortness of breath. Another important limitation is that these drugs have a narrow therapeutic window. So a small increase in their serum levels may result in significant toxic effects, leading to coma or even death in the patients. Finally, these drugs induce metabolic enzymes, resulting in drug interactions. Due to all these features, barbiturates are not preferred for the treatment of anxiety. Now let's focus on buspirone. Buspirone increases the levels of serotonin within the CNS. This drug acts as a partial agonist at 5-HT1A receptors, which are expressed on the soma and dendrites of presynaptic serotoninergic neurons. These presynaptic receptors are autoinhibitory in nature, and when they are activated, they reduce the release of 5-HT. Buspirone acts as an agonist on these receptors, resulting in inhibition of 5-HT release initially, but on chronic use it results in the desensitization of 5-HT1A receptors, leading to loss of inhibition. Consequently, more 5-HT is released, resulting in an anxiolytic effect. Subsequently, it takes more than 2 to 3 weeks for buspirone to show anxiolytic effects. Buspirone has several advantages over benzodiazepines. It neither produces sedation nor motor incoordination. It doesn't show the tolerance and dependence that are commonly observed with benzodiazepines. The side effects produced by buspirone are mild and tolerable. It produces dizziness, headaches, and nausea as its main side effects. The only limitation of buspirone is that it is not suitable for acute treatment. Instead, it is indicated for the management of chronic anxiety states. Antidepressants for anxiety. SSRI and SNRI again act by increasing the serotonin levels within the CNS, particularly in the corticolimbic system. Presynaptic serotonergic neurons store 5-HT, which can act on postsynaptic serotonin receptors like 5-HT2. Activation of these receptors results in an excitatory response. But the action of released serotonin is limited by its reuptake. On presynaptic neurons, transporters like SERT are expressed, which are responsible for the uptake of released serotonin again into the nerve terminal, limiting its action. Now, SSRIs and SNRIs can block these transporters, resulting in an increased release of 5-HT and enhanced postsynaptic activation. However, long-term use causes adaptive changes and desensitization of postsynaptic 5-HT2 receptors, which reduces anxiety. Consequently, these drugs produce a delayed pharmacological response, producing anxiolytic effects after 2 to 3 weeks of treatment. SSRIs like fluoxetine, paroxetine, escitalopram, and sertraline are indicated for the treatment of anxiety disorders. Similarly, SNRIs include venlafaxine, duloxetine, and desvenlafaxine. These SSRIs and SNRIs are used as first-line agents for the treatment of anxiety because they produce mild side effects such as dry mouth and constipation. Sexual dysfunction is another side effect observed with these drugs, but it can be managed with supplements. TCAs, tricyclic antidepressants, and MAO inhibitors are another group of drugs within this category that are nowadays less preferred due to their side effects. These drugs produce weight gain, sedation, cardiac arrhythmias, and drug interactions. Finally, let's see other agents indicated for anxiety disorders. Antiepileptics like pregabalin and gabapentin are indicated for generalized and social anxiety disorders. Few atypical antipsychotics, such as olanzapine, quetiapine, and risperidone, act through multiple mechanisms. Consequently, they have been shown to be effective in treating generalized anxiety disorders. A beta blocker like propranolol can be used for the management of anxiety as it suppresses sympathetic stimulation. This drug is particularly indicated for a few of the anxiety disorders that are associated with a rapid heartbeat and tremor. Hydroxyzine is an antihistamine normally indicated for allergies, but this drug also reduces anxiety. That's the list of various drugs indicated for anxiety disorders, but among them, drugs like SSRIs and SNRIs stand out as first-line agents. Buspirone is indicated for chronic anxiety, but all these drugs need a few weeks to show their beneficial actions. In contrast, benzodiazepines are used for acute treatment of anxiety, but they show motor and memory impairment. That's why they are preferred for short-term treatment. That's the end of the story today. Your support and comments are highly anticipated. Please don't forget to click the like button and subscribe to our channel. In our next video, let's discuss another interesting topic. Until then, stay tuned and keep watching. Goodbye, take care, and have a nice day.